Lyme disease is a vector-borne infectious disease that is spread to human beings by certain species of ticks. Lyme disease is a disease of the temperate climates. It is rarely found in tropical climates. Ticks acquire the disease by feeding on infected animals. They can then spread the disease to human beings when they attach for a blood feed. The bacteria can then spread to other tissues in the body, leading to Lyme disease in its various forms. But not every tick bite will cause Lyme disease. Whether a tick bite causes Lyme disease or not depends on several factors. One of the most important is the duration of attachment of the tick. Studies have shown that the longer a tick is attached, the more likely it is to transmit the Lyme bacteria. But how long must the tick be attached for it to cause Lyme disease? The answer to that question is not straightforward. In order for us to answer that question, we first have to understand and know the life cycle of the tick and the life cycle of the bacterium. Lyme disease is caused by different bacteria in different parts of the world. The species of tick that spreads Lyme disease is also different in Asia, North America, and Europe. In North America, it is the Ixodes scapularis and Ixodes pacificus that are the ticks that spread Lyme disease, whereas in Europe, it is the Ixodes ricinus and the Ixodes persucatus that spread the disease. In North America, Lyme disease is caused by the Borrelia burgdorferi bacterium and by the Borrelia myonii bacterium. In Europe, it is caused by the Borrelia afzelii and Borrelia guarenii species of bacteria. These differences are important since the rate of transmission differs from species to species. Borrelia bacteria live in the midguts of larvae, nymphs, and adult ticks. As the tick attaches itself in preparation for a blood meal, these bacteria migrate from the midgut to the salivary glands. In preparation for infection, they change into a more infectious form. Borrelia in salivary glands of ticks are far more infectious than the Borrelia found in the midgut. Borrelia bacteria enter the skin while the tick feeds and then travel via blood and lymph to other tissues in the body. Ticks go through 4 stages of life. They are laid as eggs, then the larvae emerge from the eggs. Larvae then transform into nymphs, and nymphs then transform into adult ticks. Upon emergence from the eggs, the larvae attach to small mammals and birds, where they feed for the first time. If these small animals are infected with the Lyme bacterium, the larvae themselves can become infected during feeding. Larvae spend the winter on the ground and emerge as nymphs the following spring. At that time, they can attach to larger animals and people when they can transmit the infection to these new hosts. It is at this stage that the transmission of Borrelia and Lyme disease most frequently occurs. The nymphs are extremely small, about the size of a poppy seed, making them difficult to see. To complicate matters even further, their bites are painless. Less than 50% of people with Lyme disease remember being bitten by a tick. And even people with the characteristic rash of erythema migrans only remember seeing a tick at the spot of the rash 25% of the time. Animal experiments show that Borrelia burgdorferi are rarely transmitted during the first 24 hours of attachment of a tick. This, however, is not the case with Borrelia afzelii spread by the Ixodes ricinus tick in Europe. In experiments done in Europe, Borrelia afzelii was transmitted in as little as 17 hours. The longer a tick remains attached, the higher the transmission rate. Although Borrelia burgdorferi is rarely transmitted during the first 24 hours of attachment to the tick, By the 48th hour, the rate of infection rises to 10%. And by the 72nd hour, the rate of infection rises to 70%. With the completion of a blood meal, 90% of people who are bitten by an infected tick become infected. To make matters even worse, several ticks feeding at the same time on the same host increase the rate of transmission even further. And if a tick detaches and then reattaches after being partially fed, the rate of transmission rises even higher. That is because the bacteria have already traveled from the midgut to the salivary glands and are ready for transmission at the next meal. Finally, if the tick is at the same time infected with other bacteria such as Babesia, this too can increase the rate of transmission. It is believed this is caused by immune suppression caused by the concomitant bacteria present at the time. Transmissibility of Lyme disease does not have a set by time by ticks. It depends on the species of tick, the species of bacterium, how many ticks have attached themselves, and whether the tick is reattaching after being partially fed. Under these exceptional conditions, an attached tick may transmit Lyme's disease in far less than 24 hours. Since these are very rare events, the best practice is to check yourself daily upon exposure. And remember to use insect repellent when going into wooded areas or hiking outdoors. Any ticks you discover should be immediately removed with tweezers to decrease the risk of infection. The tick should be grasped close to the skin and pulled straight out. Do not twist. You should then place the ticks in 70% alcohol or seal them in a plastic bag to ensure that they do not reattach. Ticks, especially the nymphs, are tiny and love warm, moist areas of the body. So use a mirror when searching or seek the help of someone else. I hope you found the video useful. If you did, like and share the video with your friends and family. You can support this channel by subscribing. Until the next video, stay healthy and stay safe.